when I was in it, decided to do my master's in Chinese medicine, which has been such a blessing for me. I love my medicine. It's a wonderful, soft, gentle, but extremely effective way to practice medicine. Just the philosophy behind it is just beautiful. But today what I want to talk about is Corona times acupuncture. So the beginning of this whole pandemic, which was March 11th, when the WHO says, wow, we do have a pandemic. On the 17th, basically, we just closed all the doors and we did not know what to do. We did not know how to approach the patient. It was a safe environment or not. It took me about 6 weeks not to see any patients and slowly introduce the maybe 1 or 2 patients I started with. But these days, what I am doing is, like most of you know, that I don't like to share my office with anybody else, but I do have to. Poor 2 MFTs that I have, unfortunately, these days they're doing it with the telehealth. But I do screen my patients a lot these days. Obviously, nobody comes in with their with the fever. Nobody comes in with sore throats or questionable, upper respiratory infections. So when I screen them, they usually come and text me when they're arrived at the door and my front door is locked. So I unlock it and then I take their temperature, usually from their wrist. There's this new interesting idea of if we take the temperature from the forehead, possibly we're damaging the hypophysis, but I'm not really sure if that's correct or not. But just in case if it is, I am taking the temperature from the wrist. And I let them into the room. I do have a certain small box that all the belongings that they have go into that room. And obviously all my patients are masked and I am masked and I am white gowned. And I have to say goodbye to my old beautiful clothes for the time being, but that's a small price to pay. I try to keep the talking to a minimum. So to some of us who have been in my office, I know, that I love talking to my patients a lot, but these days I am trying to limit that as much as possible. Just go straight to the needling part as much as possible. Just to, not to talk with the mask on so much. So it's kind of an uncomfortable thing for the patients too. And I just like to get to the treatment. And when I am needling, I clean my hands all the time. I wear gloves, I wear a mask, I wear a face shield, needle my patients. And when I take the gloves off, I clean again. So it's a constant cleaning action in the office, but it's all worth it. So far, so good. Everybody's healthy. Everybody's doing well. And some of the things that I want to talk about in terms of, especially in the initial intake, what I do is I like to do my initial intake in the car. When my patients come in, they are in the parking lot, in the car, in the comfortable, shady spot as much as they can find it, which is actually, I'm pretty lucky on that sense in my office, that we just go through the initial intake over the phone, not necessarily on the Zoom, because, you guys know me that I don't like the Zoom very much. I don't like the screen time very much, but I am very happy to talk to them on the phone, and I do take a pretty detailed history. And when it's time for them to come in, then they can come into the office for the needling, and then I do the needling. So these days, what's important is just to keep patients' immune system strong. Like Rebecca was talking about, she has the most beautiful, most clean supplements. That's excellent. And I do use some Chinese herbs, which are proven for the past, some of them goes down to, 3,000 years old formula, which has been proven themselves for a long, long time. I do use some Chinese herbal formulas to boost the immune system. But pretty much I am back on track. Like, let's say 75% of my patients are back on the office. So I am starting to see my regular kind of patients, which is the most important thing, is the pain, as you know. That's something that is my bread and butter. And almost 35-40% of my patients are cancer patients that I see a lot of patients who are going through chemo, radiation, they're newly diagnosed, they have been in remission for so long. Those are great patients for me. Digestion is excellent with Chinese medicine that I do help with patients of Crohn's, ulcerative colitis, IBS, just regular heartburn, GERD. These are great referrals for me to take care of. And insomnia is one of them. Allergies. These are the patients that I really need you to think about when you see them out there. And we have such a good health and wellness group that we do know how to communicate with each other. We do know how to pass referrals to each other. Dr. Chan sent me 2 beautiful referrals, which one of them is already done, already into the maintenance. And it was a perfect time for me to send him to Dr. Hinderman so he can teach him how to hold his body, how to exercise much better. And then he can just go on to his life, his active life that way. So we do know how to share the patients together and help each other together. But if you know someone with pain, that will be the most important thing to start with in the acupuncture world. Most of you know that I do start seeing my patients 3 times a week. That is very important in the beginning to get the momentum going, get the healing going. And when symptoms improve, I do space them out to slowly to a gradual maintenance. And that's, sometimes we do work on the same patients at the same time together with Dr. Chan, Dr. Hinderman, and Kristen. I'm so happy that she starts practicing again. So again, those patients are the most important patients in terms of, these days taking care of in terms of, for you to remember. Pain, cancer, insomnia, gut issues. So I have literally 27 seconds. I do want to thank all your referrals. I cherish them. I really appreciate being a part of this group. You guys have been wonderful for me. I really appreciate being here. Even though I don't like Zoom, I love you all. And thank you so much for your time, guys.